COVID, and certainly we have. But unfortunately, this turn may maybe a turn for the worse. And we're going to talk through that tonight. We're going to answer all of your questions and make sure you either put those in the chat or through the Q&A function on this platform. Hit us with your questions. We'll be sure to answer those. I do want to first thank Monica and her entire team. I know they're literally exhausted from the work. When a lot of people took the Christmas holiday break off, our public health department stepped up and said, well, if everyone else is going to be on vacation, that might be the time in which they might seek a vaccine or a test, and we got to be there for them. And so Monica and her team rallied like they have for the last year and a half. And we did nearly 3,000 vaccines last week at our vac site, and well over 1,500 tests, I believe, in that same time frame. So coming off a very, very busy week and right into another busy week. But I want to take a step back, Monica, and just talk about before the holidays, before this new variant came out, we were already seeing an increase in COVID positivity. So can we, to help gain perspective for people, can we even go as far back as we entered into the fall and we started to see Delta show up in Indiana? And then kind of where were we prior to the variant? And then we'll talk about the variant, the new Omicron, in a second. But before we get to that, where were we at with Delta as a community, 3 weeks ago or 4 weeks ago?
Oh, it seems like a lifetime ago. I think we were on the way up. And, with heading into the colder weather, we are seeing that in a lot of the northern states and Midwestern states. So it seemed to track with the weather. We weren't seeing that in Florida, if you remember. And that was right around the time I think the Omicron started showing up on the coasts. But we had 0 reported cases in Indiana. We're, I think, in the last 5 states to have a reported case based on the sampling that the state did. So we knew we're like one of the last to get Omicron. So we're still like in this rising Delta wave. And right now, from the information that we're getting from the state, from the sequencing, at least that they did on the labs that were submitted last week, we're still at 75% Delta. Now this week, by now, I think we can safely say it's probably over 50% Omicron. But as of last week, the majority of the cases were still Delta. So we have this like melting and this overlap, whereas some states have had a more defined separation, but we have Delta with Omicron on top.
I want to separate too between the state of Indiana and Fishers, because they are distinctly different. And that's not to pound our chest, but statistically, in terms of our people being vaccinated, as we were towards the end of the fall, our vaccination rates far outpaced anything in the state of Indiana. Can you talk a little bit about kind of prior to Christmas, the percentage of people that were vaccinated in Fishers and relative to, say, Indiana?
Yeah, I mean, just even right now, the numbers that we're seeing, we're at 90% of all adults 18 and up having been vaccinated, at least with the first 2. And at least from the last full analysis we had, I think we were at 40% boosted. And that was before our big push that we made last week, with getting almost 3,000 people vaccinated, many of whom were getting boosted. So we have much higher vaccination rates than the rest of the state. Our full vaccination rate for our entire population is over 70%, and that includes kids under 5 that can't even be vaccinated yet. That's for our total population. So we know that we're doing very, very well on that count.
And I think we were seeing that, right, Monica, in the surveillance reports that you and I get from our epidemiologists. One thing that really stood out this fall, and I know there's a lot of rhetoric around this, but when we look at just a microcosm of Fishers, the percent of people hospitalized that were unvaccinated versus vaccinated was very telling. And that trend has continued all through. But I mean, if you were to look at a graph, it doesn't take a statistician to understand the difference between the two.
Yeah, I mean, certainly, over 80% and close into the mid 90s of percentiles of people who are hospitalized with COVID right now are people who are unvaccinated.
So one of the things that we've noticed recently, and this is going to be a challenge as we move forward with this new variant and just how quickly it's spreading. The federal government, President Biden has said he's going to buy 500 million at-home tests to try to free up supply so that people don't have to come to our testing site necessarily or try to get to a testing site. One of the questions we've had and continue to have, I see one here tonight, if someone tests positive at home, how are people like yourself or Josh or epidemiologist, how are they going to be able to have a firm grasp of the number of people infected?
So we don't collect that right now. There's no portal to submit that information. It's certainly something that we could pretty easily set up, but then you run into the risk of how do you base the truth in reporting? How do you know how many total tests are done? So you can't get a percent positivity rate. There's a lot more of a question mark around those, just like there is honestly about the rapid tests, because even though we're required to report those to the state, they're not 100% reported. There's lots of places that aren't submitting that information to the state. So I wouldn't even say we have a true grasp of the positivity rates for rapid tests that are done in labs. We know the positives, but we don't know how many tests are performed. So a lot of this is going to continue to be some guessing, extrapolating. Our percent positivity rate is one good measure of how much access people have to testing. It doesn't necessarily say about the at-home test, but it's just another layer of complexity into the data analysis for all of this. But it does tell us something when our positivity rate is as high as it is right now.
I want to dive into that for a second, because going into the fall, our residents were doing really great getting vaccinated, going to our vaccination site. We were outpacing the state and the country in getting that done. We weren't seeing that tremendous number of hospitalizations out of our community, very limited deaths associated with COVID-19. Kids were in school. We're moving right along. Delta starts to pick up in Indiana in general. Bless you.
Excuse me.
And then all of a sudden, unlike anything I think you and I have seen to date, this new variant comes, and the hockey stick growth in terms of the spread of this thing is really pretty extraordinary. So can you just talk about, like, in the last 10 days, what we have seen in terms of, number of cases, percent positivity? Because I don't want to scare people. That's not the point here, because there are some advantages to the fact that this variant isn't as severe, but just to understand the true scale that we're about to spend the next 3 or 4 weeks going through, can you just talk through some of that, please?
So we, our previous all-time high of cases reported in one day was last December. I don't have that number handy, but it was like slightly over 300. And then on the 28th, so late last week or mid last week, we had our second highest, that then eclipsed it and became our highest date reported so far. And that was 354 cases that were reported on the 28th for us in Fishers. I think that was the same day, or maybe off by one day, of the state's high that they previously reported. We now broke that record again today, according to the new reports from the state, statewide. I don't have another number for Fishers on that yet, but I fully expect that it's just going to be higher and higher. For example, just over the last 14 days, our 14-day case rate average is 163 cases per 100,000 of our population. So it's roughly 163 cases a day, since we have roughly 100,000 people. The 7-day rate is 210. So we see how fast that jumps. So we're averaging the whole 2 weeks, then we average the most recent week, and it already has jumped a lot. One of the other things we look at is the case rates of vaccinated versus unvaccinated people. So when you look at all of the vaccinated people and you think about, well, 90% of adults are vaccinated, it's really a numbers game. So if you think of 90% of adults are vaccinated, you're going to know a lot of people who are maybe having a breakthrough case of COVID who have been vaccinated. So when you hear these anecdotal stories, yes, it's possible to have COVID after you're vaccinated, but the rate between the people that are getting it who are vaccinated versus unvaccinated is still dramatically different. Our unvaccinated case rate is 264 versus our vaccinated case rate is still under 100, even though the average is
Right.
In the middle.
Right, because we are going to hear this from people who are just philosophically opposed to vaccinations in the first place, or maybe hesitant about them, and they're going to say, well, what the heck was the point of me getting this vaccine if I know my friend down the street, he got fully vaccinated and he had a breakthrough case? So talk a little bit about, I think this was true with Delta and this new variant, that just because it's a breakthrough, there was still a marked difference in hospitalizations and deaths for those who were vaccinated versus unvaccinated.
Yeah, there's absolutely a huge difference, particularly with the Delta strain, right? The Omicron, all the data seems to be pointing that it's not as serious of an effect. It doesn't attack the lungs like the COVID that we've been used to. It's hard to say that. Has been doing. It more lodges in the throat and the nose. So it's not quite as dangerous for the breathing in the lungs, but there's still a very big difference between vaccinated versus unvaccinated on the likely outcomes should you be hospitalized. And that's important, not just for your personal risk, but also for our risk as a community, because we don't always know who that person is, that's going to really suffer from either Delta or Omicron. So Omicron may be less serious, but it doesn't mean it's not deadly. And it doesn't mean it's not going to take some people out, maybe less than Delta. So great, but
Right.
there's still a benefit in all of us contributing to this solution together and doing everything we can to kind of slow that spread, so that we don't overwhelm our hospital systems. At this point, the more meaningful figures are the hospital capacity. We know the cases are rising exponentially, and it doesn't quite mean exactly the same thing as it did before. We have vaccines, we know the mortality rate's lower, but just from a numbers game and a hospital capacity standpoint, that's where the kind of the scary part is.
So when we talk about this new variant spreading as fast as it is, one of the things that people are talking a lot about right now is staffing. So, the schools are worried about substitute teachers or teachers being available. Police and fire are worried about being able to minimum staff. And just if you're a business owner in general, you're worried about your ability to function. The fear of hospitalizations and death are still there for cases, but now we're talking more about the practical realities of how do I function with this just mass outbreak of this disease. And so can you talk a little bit about the CDC's recent change in guidelines around how long you have to quarantine? Because it has gotten so confusing for people as to what they have to do or what they don't have to do. So first and foremost, if you do have COVID, if you are tested positive for COVID, what is the CDC's guidelines today for what you do after you've been diagnosed with COVID?
So I first want to separate that these guidelines don't 100% apply to schools, and they really don't apply to daycares and preschools and early childhood. Those fall under separate guidelines. The schools are kind of in a 50-50 zone right now, so there are some differences with those. But for the adult who is, working and wanting to know what to do when they have COVID, if you do find yourself with COVID, you have a positive test, the new guidelines say that you only need to isolate, and it doesn't matter if you're vaccinated, boosted, not vaccinated. If you have COVID, the guidance is the same. You isolate for 5 days. Day 0, when you're counting, starts the day that you start having symptoms or the day that you get tested, whichever of those things happens first. So if you start having symptoms and you get a test on day 3 and find out that you're positive, if you've been isolating for 5 days and you're feeling well on day 6, 0 day is the day you started. If you're feeling better, significantly better, and you haven't had a fever in the last 24 hours, then you are able to go about the community, go back to work, or whatever it is that you do with a mask on for an additional 5 days. So you're still going to do that 10-day isolation, sort of, but 5 days have to be in your home, truly isolated. The other 5 days, you just need to be wearing a good mask.
So one of the issues out there is this daycare kind of standard versus the rest of the CDC guidelines. Can you talk about how the health department plays into that, or who does the daycare ultimately take their direction from when it comes to these issues?
This is definitely a hot issue. So the daycare, all of the guidance and actually the state laws on communicable disease laws fall under the State Department of Health. But the governing body for the daycares is the FSSA, the early childhood branch there. They have very specifically said that daycares and early childhood are not to follow the 5-day guidance. They may, however, in some circumstances, follow the previous guidance of the shortened quarantines for the 7 days, 10 days, and 14 days. That was the previous CDC guidance. That was also very confusing because there were multiple different days. All of it presumes that you're going to wear that mask during that period of time. So you have to be a kid that's older than 2 in order to do that. And you have to be willing to keep that mask on, that kid, if it's going to apply to children. So the FSSA is not willing to change that guidance right now. It's possible the CDC may update that. Like, we're thinking they're probably going to update their guidance for schools also. They haven't yet done that, but we're hearing that that's happening.
So when HSD schools or a daycare says we're following CDC guidelines or state guidelines, that's not in essence a slight to the Fishers Health Department. It's that we would be passing along whatever CDC or state health department guidelines would have for schools as well. Is that fair?
So we typically would follow CDC guidance, and we have to follow at a minimum state guidance. We have the ability to make more strict or strong guidance than the state, but we have not done that in a while. We did that early in the pandemic, if you recall, first when there wasn't any guidance, and then when it didn't seem like there was enough strength to the guidance that we had. But at this point, we're following everything exactly that the state is putting out and that the CDC is putting out. The state's following the CDC, we're following the state.
I want to take a minute and go back to vaccines for a second, if I could. There was a lot of conversation, three major vaccines, right? Johnson & Johnson, Moderna, and Pfizer. And there was some discussion at one point about Johnson & Johnson and whether or not it was effective or not, whether they were going to continue to provide that, whether Johnson & Johnson's booster was going to work. And I think people got kind of caught up in that and trying to figure out, well, what should I be getting? Can you just talk about, as we sit here today and someone's contemplating going in and getting a booster or getting their second shot or what have you, what's your advice to people around that subject?
So at this point today, Moderna and Pfizer are considered the preferred vaccines. So the State Department of Health actually stopped offering Johnson & Johnson at the track. However, it's still allowable and it still is the better choice for some people. So we're still offering at our site, but we are requiring a medical consultation for the only reason being that the FDA did put a warning on Johnson & Johnson because it has a small risk of blood clots for women with certain risk factors. So we make sure that everyone is fully aware of that. And if they want to still decide to get Johnson & Johnson, then that's what we do. with that awareness and that consultation documented. The Johnson & Johnson vaccine may still be a very effective vaccine in the long run. It works a little bit differently. There's other studies showing that it may be a slow and steady wins the race. But at this point, Pfizer and Moderna are definitely preferred. The antibody levels are a lot higher. The protection is a lot higher. We have way more data on them, and they don't carry that risk of blood clots. So at this point, they are considered preferred. They both use the same process for the vaccine with using the messenger RNA. And we would recommend either of those to get a booster. So if you haven't yet been boosted, if you got the Johnson & Johnson the first time, you only need to wait 2 months before you get your booster. So if it's been more than 2 months, come in and get your booster. You can pick from any of the three. Again, we'll recommend Pfizer, Moderna officially, but you can still choose the Johnson & Johnson, once we talk to you, if that's what you feel like you need to do. And if it's been, they also updated the rules on the booster timeline for those who got Pfizer and Moderna. It's now 5 months instead of 6 months. So if it's been at least 5 months since you had the Pfizer or Moderna vaccine, then you can get the booster for that. I will also say the CDC just signed off on boosters for 12 to 15-year-olds. I'm expecting to see a news flash that Dr. Walensky signed off sometime tonight. That's what she's been doing, is sometime around midnight. We get the news flash. So we're fully expecting to offer those tomorrow.
Yeah, that was a question that came in, that they called today to get their child who's in that 12 to 15 range. We said we were not providing that. Can you explain, even though that might be something CNN may say, CDC's now approved, what's the trickle down before we can actually administer that?
So we, as a vaccine provider under the VFC program with vaccines provided by the state, have to follow the ACIP recommendations, which is the Committee on Immunization Practices through the CDC. So the FDA first approves something, and we see those news flashes. We saw that on Monday for these boosters. Then the CDC committee has to meet, and that happened today. And so that committee has signed off, and then the final step is that Dr. Walensky, the head of the CDC, has to sign off, and then we can start administering. Again, I fully expect that news flash sometime tonight, and we're prepared to start offering those tomorrow morning. And again, it just would need to be 5 months from the second dose.
And right now, you're at a point at the vaccine site where, from a resource perspective, if the CDC says you can do it, we're allowing for walk-ins and things of that nature. Is that correct?
We're allowing for walk-ins. Of course, it's going to go faster if you have an appointment and you're pre-registered. We did add more appointments so that more people would have the opportunity to do that. And there were some open as of midday today, and there were certainly some open tomorrow and beyond since we added those appointments. So as soon as you see that news flash, you can go ahead and sign up. And we should be able to offer those. You may not be able to sign up under the official, it says it's allowable. It usually takes the state a couple of days to catch up with the software changes that need to happen. But we will start administering those as soon as we know that the CDC director has signed off.
Yeah, we talk about these boosters for younger kids. It reminds us that, just Tuesday, I put my 7-year-old back on the bus after the holiday season. I know you put your kids back in school. There's been a lot of conversations. In fact, when the numbers started going up, I started getting text messages from random people in the community saying, whatever you do, Scott, don't close the schools. We can't go through that again. And I think across the board, most people would say our goal is to keep our kids in school. And one of the things that you and I have been talking about is how we could provide some infrastructure to try to help, particularly in these next 4 to 6 weeks, when we just know this new variant is going to run its course through our population. And children and faculty at our schools are going to need access to testing. Mm-hmm. We don't have any definitive answers right this second, but can you just talk about some of the work underway that we're going to try to provide to the families and to the faculty of HSE here in the coming days?
So I want to start by just letting everybody know how many tests we're doing, because it is outstanding. It's just a really high number. We we did over 2,000 tests last week, being open 4 days in the week. So we were doing over 500 tests a day. We added 100 more this week. So on Monday we did, for example, 610 tests. On Monday. So we added an extra hour, we added 100 more tests. We continue to maximize everything we can put through the vaccine site. Next week, we're going to be adding at least one more hour and hopefully another 100 tests or more. Right now, we're trying to secure supplies to make sure that we can have a net increase in lots of tests. We're also looking at ways to protect set appointments for people that are staff or faculty or students of the schools, so that they have basically their own sign up and protected appointments. Our goal would be that anyone can get a test within 24 hours of knowing that they need one. So today that you're having symptoms, you can get a test tomorrow at the latest. That's the goal that we're shooting for. It involves tapping some other city resources for staffing. It involves making sure that our various labs can handle the increased volume and that we have the supplies to support that. So there's a few pieces that we're still working on, but we hope to have those details very soon.
I want to put a fine point on this, because based on some stats I saw today, we quite possibly are providing more tests than anyone else in the state of Indiana right now. Secondly, if you can't get the test at our location and you're a mom or a dad, or you have a kid that needs it, you're going to have to pay market rate of $100 or so if you go to a testing site. I assume you can get a rapid test if you can find one at Target or what have you. But these are 100% free to our residents that we're being able to provide. So you mentioned last week we did 2,000, is that what you said?
2029.
2,029 tests.
In 4 days.
In 4 days. Those are 2,000 residents that were able to receive a test for free in a timely fashion. And we're ramping up even more testing so that we can keep our teachers and our kids in our schools. And so I just want to compliment you and your team on that. I want to go back to there's a specific technical question someone has, and I've heard this before, both on vaccines and on boosters. If I test positive for COVID, how soon after that can I go get my booster shot or my vaccine?
So you are allowed to go get it as soon as 10 days after you test positive. So, or your symptoms start, whatever your day zero is, if it's symptoms or test, that's how we calculate it, whichever happened first. So after 10 days, if you're feeling well, you may then go get your booster. You may choose to wait another month or two, and that's okay. We would still assume that you would have antibodies that would be protective in that month or two. We wouldn't recommend that you wait more than 90 days. One exception to that is if you receive monoclonal antibodies as part of your treatment for COVID, you have to wait 90 days. That's really the only exception.
So we've had a couple of people say this, and I don't want to ring alarms necessarily, but I do think it's important for people to know that because of this widespread COVID that is impacting our entire country, there could come a point where staffing shortages are a reality for a variety of different professions. And I know that we want to keep our schools up and functional and operational. So if there is anyone that has the ability, the desire, or the interest in substitute teaching, being a bus driver, helping out in the kitchen, whatever, certainly you should reach out to our school system and demonstrate that interest, just because it's going to be good to have those backups in the case that we get to a point where just staffing becomes a challenge. So by all means, chip in wherever you can. And to that point, Monica, I want to talk about your team a little bit. So they've been running really hard for a very long time. How are they holding up with not only dealing with yet another kind of outbreak but now, some of them are getting sick. how are your capabilities holding up as the demand for both vaccination and tests seem almost insatiable? So how's your team holding up?
So, I mean, our team has been running on all cylinders, certainly all last week and this week. Everybody that can work is working to the maximum of their ability. A lot of our vaccine staff are part-time, and a lot of them are retired. And this is just something they do to feel good about serving the community. So, you know, they're not in this to do this 6 days a week. But they're all stepping up, and we ask them to pick up extra shifts to meet this demand, and they're doing it, but they can't do it forever. The testing site folks, I mean, we are a very small team. You'll see the same people every time you go through. I've been doing testing for the last week and a half. If you've come through, I've been there a couple hours almost every day. Our public health nurses, who normally are doing other things, have been there.
I do want to note, Monica, that the other day when we were short on staff, I begged you to let me go work in the testing site, but you felt that most residents would not want me shoving something up their nose. But I was ready. I was ready and willing to go work.
If anybody thinks I'm wrong on that, we'll sign them up. But
is there a need from a volunteer perspective or anything? Okay.
We do love to have volunteers, particularly at our vaccine site. Typically, the easiest thing to volunteer to do is to greet people at the front. You know, we do require that people wear masks when they come in, make sure people have appointments, direct them to the appropriate line. It's a little bit of traffic direction. For medically trained volunteers, we do have some volunteer positions where you can administer shots, but we do have a bit of a training process and sign-off process before you can start doing that. So it's not quite as an immediate sign up as the other volunteer positions are. We're not using volunteers for testing. I don't know if we'd get any, but as far as the staffing question that you asked, you know, we're having the same challenges that every other agency is having. You know, if we have 2 people out because their kids or themselves are sick, then we're short-staffed, and that means the lines at the testing site are longer. We can't process people through the vaccine site quite as fast as we normally would, you know, when we're not running on all fronts all the time. In the past, we've been able to shift like some of our testers over to the vaccine site when that demand was high, and then shift our vaccine site staff over to the testing site. We never have been in this position where they're both 100%. So we're as stretched as we've ever been, and we're calling on other city staff to help with some of these extra things, particularly with the testing, to get more access. But every department is feeling the same way, just like all of the businesses are feeling. Everybody has people that are out with COVID, even with the shortened guidelines, even with the faster progress of Omicron through the symptoms, it still is hitting everyone just from a sheer numbers standpoint.
So someone has made a comment that 2,000 tests isn't nearly enough for a population of 98,000. Can you just talk a little bit about what are the constraints? You know, obviously in a perfect world, we wave a wand and we'd have 100,000 tests readily available for anybody that needed a test. What are the system constraints that keep us from having 7,000 tests a day?
Well, system constraints, partly on the rapid tests. We still don't have unlimited supply of rapid tests. We're limited to, I think, 300 of those a week from the state right now. Our PCR tests were limited by our lab because they want to make sure that we can get results turned around in less than 2 days. So in order to do that, we have a cap on the number of appointments that we can schedule. And then on top of that, we're limited on our supply chain. So from our other lab testing process through the state, like I said, we're exploring all avenues to try to make sure that we have enough supplies to be able to bump up the testing at the level that we think we can handle it, which is significantly more, but we don't have the supplies on hand, and that process is lengthy. Not super lengthy, but we need a week's notice. So it's not very adaptable. It's not something that we can swap out lab tubes easily with, other ones that we have on hand. The whole state is here. So the whole state is tapped out on resources. So when we call someone and say, this is urgent, we want to up our process, we want to double our appointments, there's nobody to answer that phone. So we have to wait until they stop their testing that they're pulled to do, like we are, and, get those answers back. Everybody's working on all cylinders right now.
Can you talk a little bit about how you guys have done some unorthodox things over the last 3 or 4 months to get out in the community and really try to meet people where they're at? I think you had a really successful vaccination site at Fisher's High School not too long ago. I know you're going to the EMOM school. I mean, can you just talk about how being part of this community, you guys are been out there getting involved, nursing homes, you name it. I mean, talk a little bit about not just the vac site, but where else are you guys going to meet the need of our residents?
So, I mean, we started back in the spring and summer. We did a lot of outreach to the business community, and we did a lot of vaccines, pop-up vaccine clinics for various businesses. Then we were at the farmers market every single week, offering vaccines at the farmers market. We were at basically every city event offering vaccines, any kind of event where there were likely to be a lot of people. We tried to make it easy to offer vaccines. We were at some Tuesday evening concerts, the Friday evening concerts. We have been to Iman schools, and twice. We were at Fisher's High School 2 weeks ago, and we have another clinic coming up on Friday as well. I will say, if you're thinking about that and you already have an appointment at our vac site, that's going to be more efficient for you to stay at the vac site. We are expecting a very large turnout at Fisher's High School. So it would be easier to go to our mass vac site where we're already set up, unless there's some real reason why you need to be at the high school. It is going to be a bit more of a wait, because that isn't our normal clinic. But we saw 350 or so people 2 weeks ago when we were at Fisher's High School. We already have 200 people pre-registered for Friday. So we're definitely trying to be everywhere. We've been doing a lot of work with all the long-term cares. We reached out immediately as soon as we knew boosters were coming to make sure they were covered. Some of them are covered by other agencies, which is great. Some of them were not. So we stepped in and did all the boosters for any long-term cares. So we've covered all of them. If you remember back in the spring, we did a lot of homebound vaccines. So we went to people's homes that couldn't get out or who are very ill and were worried about exposure risk. And we did a lot of vaccines in the home. We circled back on all of those individuals to make sure they had boosters as well. So I'm not sure what more we can do, honestly, as far as outreach. We've done everything we can think of.
I think a 90% vaccination rate's darn good. A couple of things, as we kind of close out the hour, I want to touch on kind of forward thinking or forward looking. There's been some talk about a fourth booster shot out there. Is that something that's in the near future, or is that more speculation at this point that there could be a need for an additional shot?
I think that's speculation, heavy speculation at this point. I think most of us would expect that this will become some kind of seasonal thing, much like the flu shot. I can't say that I expected to have a booster at this point in the pandemic either, but I don't think that many of us are going to tolerate unlimited vaccine boosters every couple of months. So I don't know how realistic that is of a game plan going forward. And, as you mentioned earlier, Omicron may be somewhat of a blessing in some respects, certainly not all, certainly not the strain on our healthcare system with low vaccination rates across the state. But this is kind of the natural process of viruses like this, is to get more infectious and less dangerous until they become kind of generally circulating.
One of the comments we just got is, they appreciate the kind of specific work around vaccines and boosters and things, the kind of traditional tools for making sure that we can help people deal with the COVID outbreak. But there's a broader conversation that you and I have had around really making sure that our people are well positioned physically, from a health perspective to deal with this. Some of the reasons that Indiana hasn't fared well isn't actually because of the virus. It's because of our preconditions that, complicated with the virus, makes it very difficult for some people to fend off that disease. So can you just talk a little bit about long-term? This isn't something we're going to be able to fix tomorrow, but why public health and really making sure that our population is addressing some of these longer-term chronic issues, whether it's obesity, diabetes, pulmonary issues, to be able to weather the storm better. You're still going to need these traditional tools, and thank goodness we have them. But can you talk a little bit about just where we need to go next in that regard?
So as a new health department, we're starting our assessment. We've had a number of focus groups. We'll have a report pretty soon on the findings of those. So we've done some surveys just to really start doing a broader assessment of our community. I can tell you what we know right now. I mean, we still are within Hamilton County, which is still the healthiest county in the state by the standard metrics. So we're still going to fare better than the rest of the state. And so the rest of the state fares quite poorly on most measures of health. And we're at the top of that bottom. But I think we all know that we can do better. We're in a lucky position of being a generally healthy community, but we know that we've got a lot to work on with mental health, and that's been a push for the city for quite a while. Our relationship with alcohol isn't the best. That's one of the things that we're not top at, that we show that we struggle with. So we've got some kind of obvious indicators, and then, like I said, we're doing this broader assessment to figure out where we target our resources and how can we create this this community and this society in Fishers where we can make it as easy as possible for people to be healthy without even hardly trying, right? So it shouldn't be something that you have to think about and work at all the time. It should be something that's natural and easy to do, and that's going to set us up for long-term health wherever we go from here.
One more technical question that I have, kind of an open-ended question for you to close it out. But if the 12 to 15-year-old boosters are approved, let's say tomorrow or tonight, at your high school pop-up event, will you be able to administer the 12 to 15-year-olds as well?
We will.
Okay.
And we will also be able to administer them at our mass vaccination site.
Yes.
So
don't flood the.
I know that everybody's excited to come to the high school. We've definitely gotten that feedback, but we are better prepared to serve you at the mass vaccination site. So if there's an ability to go to that facility, I would still encourage you to do that. So
I want to close with more of a broad discussion or observation. Hold on, there's okay, one more specific question, then we'll get to the broad question. The question is, rumors are growing that being vaccinated and or boosted actually puts you at a greater risk of the Omicron variant. Have you heard this, or do you believe there's any validity to it?
That being vaccinated and or boosted makes you more at risk?
More likely to get this new variant.
No, and in fact, our data doesn't support that, just our even locally analyzed data. Like I mentioned before, persons who are unvaccinated have a 2 to 3 times higher rate of getting COVID. Now, you're going to know a lot of people that have breakthrough cases because 90% of Fishers adults are vaccinated. So from a numbers game, it just doesn't quite, you can't use anecdotal stories to make those conclusions. So when we actually analyze the data statistically, we find that is much higher rates of spread among unvaccinated.
So I want to close out with a broad, open-ended question. When you and I first met, we were in the throes of the early days of the pandemic. We knew very little about what was happening. We didn't really know a lot of the long-term consequences, what COVID was going to do. There was a lot of fear of the unknown. Today, we've just come so far from where we were. But it's hard to know, it's hard to gauge what perspective or what lens you should view any given time frame in around COVID. You know, what is the perspective I should have for my family around COVID right now versus, let's say, last summer or in those early days when everyone was locked down and scared to death that they were going to get COVID, end up in the hospital and on a ventilator, and they were going to pass away. You know, so from where you sit today as the public health director, who I think you've earned your stripes here in Fishers as a source. I mean, you were on, I don't know if people know this, but you had 9 TV interviews last week. People look to you for insight into kind of what's happening, where are we? You're a mom of 2 kids, you're in our community. You know, what perspective would you give people around where we sit today? Like, how should a mom or dad think about kind of the next few weeks as we look at it?
So, I mean, I think everybody has some need to make their own decisions on some of this. Everybody has a different risk tolerance. And that's where we're at, is where we're saying, okay, our risk to our specific community is relatively low given our very, very high vaccination rates. Our risk to the broader community, however, in Indiana is very, very high given the low vaccination rates. So we're sitting in this little Fishers and surrounded by this larger area that has a high risk, right? So we want to be part of the solution. We don't want to have to be, let's say, going to the hospital with a broken leg and getting stuck there for days waiting for whatever we need to wait for a bed or something like that because the hospitals are full. So we do our part to protect ourselves. The easiest thing to do that with that is vaccines. It's not going to stop the spread entirely, but it is going to decrease those hospitalization rates. But when we're making those risk decisions, for me personally, I don't have anyone in my household. I'm very lucky to have no one in my household who would be considered very high risk. My parents live a couple hours away. I don't see them very much. So I don't have anyone living with me that I'm excessively worried about all the time. Should I get COVID or should my kids get COVID? That being said, I don't want it. I haven't had it yet. I don't have any wood to knock on, but I don't want it. I'm trying not to get it. I want to be as safe as I can. So I'm stepping up the mask game right now. I've purchased surgical masks and N95s, and I'm sending my kids to school in those. And that's what I'm doing for myself now when I'm out and about. And I am curtailing some of my activities. Some people have had COVID. They feel like it wasn't that bad. The consequences weren't that bad. Frankly, we still don't know a lot of the long-term effects. So we're not as scared as we were. I don't want everybody to be terrified about everything, but there's still a lot we don't know, and all things equal, I would rather not have it. I don't try to get the flu every year. I'm not going to try to get this.
Well, I think to your point, with that knowledge really is empowerment to make those decisions and take the appropriate measures, whether that's getting a vaccine, getting a booster, to your point, not going out to a crowded bar on New Year's Eve if you choose not to do that, and wearing a mask if you see fit to wear it. So I think one of the things that you've done a great job of is continuing to provide candid and honest feedback about where we are as a community so that people can make those informed decisions. And honestly, I'm really proud of Fishers residents having given that information, stepped forward and outpaced most of the state, if not the country, in putting some of those tools in place to make sure that they're safe. And I think that's a testament to our residents and a testament to the work that you and your team have done. For the foreseeable future, at least for the next few months, our vac site will still be up and running at the marsh, the old marsh on 116th and Brook School. We'll still be running tests. So I think the takeaways here, and Monica, you chime in here, be informed, make the appropriate decisions for your family from a risk perspective. Use all the tools that are provided to you. We will be sharing more information on how we can help our schools with the infrastructure that they need to keep up and functioning here. Hopefully, maybe by the end of the week, we'll have a full plan for that. Maybe early next week, just depends on if we can get everything lined up. And I guess, Monica, I'll let you close it out with any final thoughts that you have, any parting wisdom that you might have for our residents before we sign off tonight.
I guess now's the time to really assess your risk level for yourself and your family, and what steps you need to take to protect yourself over the coming weeks. We do expect this to be a pretty awful couple of weeks from a numbers perspective. We suspect that it'll burn through pretty quickly. Omicron is shown to spread so fast, and then it goes down really fast also. But if you're very, very worried and very committed to protecting, yourself or your loved one that's at very high risk, really now's the time to kind of take all of those extra measures for you and your loved ones. But we'll get through this. And I have no doubts that our community is gonna shine through this. I know that it's not fun for anyone. It's certainly not fun for me. But we know we can do this. We know what we need to do to protect ourselves. We have the tools to do those things. And we're here and trying to make that as easy as possible for our residents.
Well, Monica, go get some rest, because tomorrow I assume you'll be giving a lot more shots and a lot more tests. And thank you for you and your team's efforts in regard to this. And I'm sure I'll see you around tomorrow.
Thank you.
Bye. Bye, everyone.
Bye.